Many people who are on the webinar right now have IBD, or they have a loved one with IBD, and they're worried about them. Many of them are immunocompromised, and to not get this disease today is going to help them down the road. We should be pushing this out as far as possible so that we can not overwhelm the healthcare system, which is desperately working right now to try to get on top of this as the cases are peaking over the next few months. And it's the one thing that you can do in your control. I feel a lot of people are powerless. They lack control in this situation. I know I do. And it's the one thing that you can take charge on is to do the social distancing, to remove yourself, and not to get infected now.
It's Lisa. Just to add a smidgen onto that, I keep telling people this seems not like a very high-tech or sexy thing to do. Wash your hands, stay away from people, and disinfect things around you. Use good cough hygiene. It is incredibly important, and some studies have modeled that just doing those things, as your presentation noted, social distancing and washing your hands well with soap and water, not high-tech, not expensive, as well as staying away from other people in the context of disinfecting things, up to 50% useful in preventing infection. And that's power. It's not sexy, but it's power.
So Lisa, it's Remo, and I completely agree. And we know that, we're lucky in Canada, I think, because we have examples of where those type of interventions have been successful, right? So if you look at South Korea or Japan, where they really adhere to that, those are cultures where you tell them this is what you need to do, and they will do it. And look at Japan, who has I think 924 cases, where some places in Europe have equal, and that's where it started, but of equal size as far as population, they have thousands of cases. So I agree completely with Gil. It's completely in our control, not only as an IBD sort of population, but as a general population, to actually be responsible and stop and flatten this curve.
Yeah, and I'd like to add to that as well. What you just said is perfect, because it's a behavioral decision. This is a decision that you can make that will create a different response more than likely. It fits the models, but I think sometimes when we get overwhelmed and we get worried, we feel we can't make decisions like this. But this is a decision. There might be circumstances that make it difficult, but for many of us, this is a decision I think that has to be weighed and has to be made. There's too many people out there, you heard about it a lot in the news, running around having vacations and talking about, hey, it's my spring break. I heard it on the news today, and I'm going to do what I need to do because it's my spring break. Well, it's the population's concern right now. And I think that's where I'm talking about making a decision.